Hello and welcome to the week second. So I would like to start. So for the week one, as we discussed, I just divided the week one lecture into two classes, and now I'm putting this video lecture recording in your week two instead of putting into the week one. I just wanted to give you more time to read by book and to go over to the course outline. Just in 3 to 4 minutes, we can quickly go over what we have studied in a week one. So we have discussed week one. What is healthcare informatics? What? Then we see why healthcare informatics. Then we see the definition of healthcare informatics. Then we see in the definition, we see the definition of healthcare informatics, medical and health informatics, bioinformatics, imaging informatics, and the definition about the EMEA. Now, you should know the answer to all these. If you do not know the answer of all these, please stop this video and go over to the lecture one, read your book, and also go over to the slides, and then come back. And once you have answer to these questions, then you should move on to this lecture. Okay, so hope so you guys have now answer. Most of you have the answer to these questions, and these concepts should be very, very clear to you guys. Okay, so we discussed a lot of data is being generated from multiple resources. Data is being generated from smartwatch, smartphone, payer records, to government agencies, to generic databases, and data is, you see, this is how the data is being generated with that speed. And as the data is being generated with that speed, we have new tools and techniques are available at the disposals, and the burden is more on the shoulder of the doctors, paramedics, the people working in the health sectors. They have to learn to the new techniques and tools in addition to whatever they have their primary job. Then we see the difference between the data, information, knowledge, and wisdom. We saw that how data itself does not convey much meaning, but when we combine data with another data, that become information, and that information becomes a knowledge in the form of a stored fact, and that would help us to take some decision. And we saw with the help of interesting examples of the tomato, and then we discussed with this knowledge versus wisdom kind of the columns, that how we can differentiate a knowledge versus wisdom. Then we discussed about the healthcare informatics through the Venn diagram. You guys wrote the definition on your paper, you guys watched the videos, and you got the idea that how the healthcare informatics is a multidisciplinary field. Then we discussed about the definition of a particular EMEA, and we also discussed that why there is a confusion between some people say biomedical healthcare informatics, some say health informatics. Why this confusion is there? So I gave the answer because it's an evolving discipline. That's what we have this issue. And then you guys wrote this definition on your paper, and we should know. I can ask in the exam, they write the definition of the biomedical healthcare informatics by the EMEA. You should able to write the definition or to explain the concept as the EMEA understand those concepts. Okay, then we see the difference between the different sub branches. bioinformatics, imaging informatics, clinical informatics, and public healthcare informatics. And with that, I start the week 1. So today we will start from here and would like to know in detail what these definitions are, what the difference, how we can differentiate between these definitions. Also, some historical highlights that how this healthcare informatics started, evolved, and where we are standing now. What would be the future of the healthcare informatics? Okay. So please take your pen and paper ready. So we will write every definition. You will create your own notes for your understanding. Let's read what's clinical informatics. And clinical informatics generally refers to the informatics applied in healthcare or individual in a healthcare setting. Informatics that we will apply in clinical setting, right? In clinical setting, what could be that? Like on the patient data, on the data about the treatment, about the procedures. If we can apply some informatics on top of that, we call that clinical informatics. Write whatever you got from this definition on your piece of paper for your notes. Your understanding about a concept is very, very important. Either you can write, if you still not got anything, it's totally fine. You can just write whatever they have. Generally refers to the informatics applied in healthcare or individuals on your paper. Okay. Now, remember what we have studied bioinformatics. Just don't look at this. Stop and write on the piece of paper bioinformatics. What is bioinformatics? What we have discussed that, and how you differentiate bioinformatics with medical informatics. Stop this slide. Don't look at the slide. Write on the paper. Pause the video. Right, and then now compare with that. So the bioinformatics is the application of informatics in a cellular or molecular biology. So we discussed that at the DNA level, at the RNA level, at the molecular level, at the genomics level. We see if we apply the informatics, if we apply computer tools, technology, techniques, we can say it's a bioinformatics. The subterm translational bioinformatics used to describe bioinformatics applied in human health. So the bioinformatics is basically is a basic exploration. For example, we know that this certain gene, just like BRCA2, BRCA, BRCA2 is a gene which can cause a breast cancer. If we, through the evaluation, through the understanding of the genome or DNA structure, we know we are now so sure that this gene is responsible for certain cancer, then we can use that finding to find some treatment of that. So this act, we can say that we are now moving towards the translational bioinformatics. Last time we also discussed the imaging informatics. Now again, do the same thing. Write the definition of imaging informatics, what you have studied so far, on the piece of paper, and then look at this definition. Write everyone. Okay, let's look at bioimaging informatics. Informatics with a focus on imaging, including the use of computer system. Like at this time, you see all the X-rays, all the what they call the imaging modality. We have here even the ultrasound, some machines, even the machines used with MRI. So they all are connected with the computers. We don't have any more this kind of the printed X-rays. You see everything is now connected when you go for the X-rays, they take your X-rays. It's totally on the computer in a soft form. They send these X-rays in the soft form to your doctors to look at. So the things are changing from going. We are moving towards more digitizing and using of the informatics in imaging. We call that image informatics. So these three more definitions are more. We put that like consumer informatics, the field devoted to informatics for a consumer review. That if we can use a certain, if we like to study certain drugs, chemical, if we see certain salts, certain procedures, that how it's overall affecting, like economic wise, for economically how it's affecting the overall population. This kind of study we do that in a consumer health discipline. Then in public health informatics, this, as we discussed last time, if you would like to know the application of informatics in the area of public health, including disease surveillance, if we can see that like the contamination in the water to the level of arsenic level, to the level of some lead poisoning, that kind of things we look at the public level, which is not more of individual level we see in the public healthcare informatics. Another aspect, or you can say the subdiscipline of biomedical healthcare informatics, is the research informatics. Here, what we do that as a researcher, we use informatics to facilitate biomedical health research. We get a data, as I show you in my in our first lecture, that personally, I get the data from different hospitals, from NYPQ, from other hospitals, or there are several data sets are available online, publicly free on the CDC website. You go there, you download the data, you apply different healthcare informatics techniques and computer techniques to learn something which is or to discover something, or to refute something, or to if there are any hypotheses to evaluate that. So this kind of things we do in a research informatics. So basically, clinical informatics, bioinformatics, imaging informatics, consumer informatics, public healthcare informatics, and research informatics, these are disciplines, are sub-branches, or you can say subspecialties of the biomedical informatics. This should be very, very clear to you, the basic difference. Write whatever you can write on your piece of paper and make a note so that you will have some clear idea whenever you will read your notes and watch this video, then go to slides and read the books, and with that combined thing, this should make a kind of sense to you for the later on for your exam. Okay, let's move on. Historical highlights. Let's go about the historical highlights. Let's start even very beginning, computer. 1946, the first computer, general purpose computer, was developed. And can you imagine? Interestingly, that time it used to cover the 1,000 square foot floor space. One computer. Small, the computer now we can have, even the computers that we have, even our cell phone is much more powerful than the computers the supercomputer at that time had. Then the term, first time the medical informatics, this term appeared in 1960. In earlier computer technologies and early EHR is electronic health records. EHR, electronic health records, appeared in 1960 at the VA and the Mass General hospitals. So the first time EHR terminology they used in 1960 in Veterans Affairs and the Mass General hospitals. They started speaking, oh, there is an EHR. So at that time it was kind of the EHR, everyone is at least in healthcare are familiar with the EHR, but that time was the pop word for the EHR. So the Medline is basically you can say a Google or a repository of the healthcare journals or books. They recognized the medical literature in 1960. They recognized the biomedical informatics, early EHR, medical informatics in 1960. The use of artificial intelligence in the medicine started in the 1970s. And when the earlier internet appeared, actually, it was not in the shape of the internet as we can see now. That time it was mainly used for the defense purpose by the DARPA and the Air Force and the Army and the World Wide Web, in 1990. So at that time, the first time they had started use of the word or using of the computer in medicine. So the important thing is medical informatics appeared in 1960, EHR 1970, artificial intelligence used 1970, internet appeared in 1960, and in the World Wide Web in 1990s. These are some historical highlights. Some more. Now, some terminologies, for example, the medical computer science. This term, medical computer science, it was appeared or phrased in 1970, a subdivision of the computer science. So what they did there, they put that under the computer science, CS, like under a subdiscipline. They put that is the medical computer science in 1970 first time. Then another term born, biocomputing, biomedical computing. Natural terms implying use of computers in biology or medicine was not widely accepted. So the biocomputing, this term was not got so popularity, and now the people they hardly use the biocomputing. At this time, the medical or healthcare informatics is the more acceptable terminologies. Okay. Then medical informatics, this phrase was first used in 1970, and with that phrase, they were emphasizing on the information aspect of the field, use of medical stats, record keeping, information exploration. To define all these keywords, they use the word medical informatics in 1970. Healthcare informatics appeared around in 1980s. So as I said, the healthcare informatics is more generic. Medical informatics comes underneath. If you say like this is umbrella, health informatics, medical informatics. So the concern that medical informatics is too focused by the physician. Physician said, okay, they feel that the medical informatics is too focused, and they just wanted to come up with something a broader term that could incorporate more of the broader disciplines. So the term healthcare informatics appeared in 1980. And then again in 1990, they even combined both the terminology in somehow, and they say, let's call it biomedical informatics. At this time, most widely accepted terms for core disciplines covering all the areas of application in health, clinical practices, and biomedical research, we use the biomedical informatics. So you see on your notes, this should be the key concepts should be clear that when certain things happened. Okay. Now, why we need healthcare medical informatics? We have discussed this question in our lecture 1. This is to give you a better idea. Now, as you have read your book, you have read the notes, you search about the healthcare informatics. So I'm expecting that you have the answer to this. So stop looking at the slide, write on a piece of paper why we need healthcare informatics. Whatever come to your mind, it should not be a complete definition, keywords, whatever come to your mind. Just write your understanding why we need healthcare medical informatics. Then look at this slide. So the healthcare informatics, basically, we need that for healthcare management, planning, policy, all need good information. Remember, we started with data and information, right? And we say we want to go from data to decision, right? When we say we want to go from data to decision, then let me put the charger. The battery is dying. All right, I'm back. So we said the data to decision, right? So everything starts with the data. We need information from to make a good wise decisions. How much we should spend that, at what county we should spend that, why we have spent that. So all these need some information. Then we say data driven decisions. We need some insights. So it's not with the beauty of the computer science informatics is this: it's no guesswork anymore. We use we need database evidence to take a very calculated decisions. Just to I have mentioned over here an example. So one study shows that it takes average 17 years to translate a knowledge from randomized controlled trials into a practice. You know, one medicine, it takes years and years, like the Disprain, from the clinical trials to the rolling out, it takes billions of dollars. Medicines lack an information infrastructure to efficiently connect those who produce and archive medical knowledge to those who must apply that knowledge. If we would like, for example, now you see that how quickly they have developed the COVID-19 vaccine. Less than a year. How it was possible? I mean, the development of the penicillin, and that was all miracles. That time that happened something, the people even they don't have the idea. But here in the COVID-19 case, the people they take a very scientific and calculated kind of the knowledge to produce this vaccine in a very short time. There is the one thing is that at this time we have a lot of tools are available that could automatically do the search for us, that could automatically fetch data from the literature which is available from on the internet, and can give us insights if they would like to see that how the vaccine, how the flu vaccine worked in when it started in 1990, and then how the things were evolved. So many kind of the questions that for someone, if they would like to find the answer, maybe take hours and hours, or maybe days and weeks. at this time, with the help of informatics tool, information retrieval tools, we can easily search, find the information almost automatically, or if not automatically possible, at least semi-automatically. That's the one reason it takes we see that now the more and more better medicines are developing in a short time. Now, more driving force, just more ideas are like why we need medical or healthcare informatics, why we study that, what's behind medical or healthcare informatics. So please write these points on your notes as well. Number one point is it increases the healthcare efficiency and productivity. With the medical efficiency and productivity, we see the example of if we keep record of the spendings in a medical healthcare setups, we can see the history. We can see that how in which month we spend more, on which drug we can spend more, on which procedure we can spend more, on which resource we can spend. So we can take a better decision based on that. It improves healthcare quality, patient outcomes, resulting in improved patient safety. As I gave the example, doctor can use that healthcare informatics tool, artificial intelligence, machine learning, to know that how they have treated their previous patients with a similar kind of conditions. And with the automatic charts, automatic graphs, they could get the idea about the use of certain procedure or medicines, what was the efficiency of that certain medicine, and what treatment environment they use, or what was the overall procedure which they have adopted that. So based on that, with the new patients, they can use or they can even refine the procedure which they were currently practicing. And with that, it reduces the healthcare cost overall, because when you use the data to make decisions, definitely it reduces, if you take a very calculated decisions, and the chances of like comparing with a guesswork, the chances are much more, it increased a lot more chances that you will succeed comparing with just guesswork. Then improvement in healthcare access with technologies such as telemedicine. You see, at this time with the COVID, everyone we use several tools, ZocDoc and others, and it was not even a concept like 10 to 20 years ago. People had no idea that how they can use, how the people living in suburbs, how they can contact with the health specialist. Some old people, the people like a pregnant woman, where they have difficulty in traveling. At this time, everything is at your disposal with just pick up your cell phone, smartphone. With your application, you can consult your doctor, and you can get your medicine at your doorstep. So all this possible with the help of healthcare informatics connected technologies. And with that, as it's obvious, it improves the coordinations and the quantity, continuity of care. Doctor can easily know that if the patient discharged, when they go home, they can keep in touch with their doctor, can update about their BMI, their temperature, their kind of other vital signs, and the doctors can continuously give them their opinion. So it's a kind of continuity care. It's not the things they have to wait for the 2 weeks or 3 weeks to see the doctors again. Okay, then it comes to improve medical education and clinical patients. You see, as we learn from this process, the doctors learn, they share their experience with their peers, and with that, it improves it updates the older medical knowledge. It educates continuously to the people working in the healthcare setups. And last but not least is the standardization. Now you see that we have the drug codes. If you go to the pharmacy, each drug they have some medical drug codes. They have some generic name. They have some brand name, and they also have some the drug IDs. Then the patients, we have the patient ID. So in the healthcare, we try to make the everything is standardized. One reason of to making the things standardized is like for the integration. If we would like to integrate a patient, for example, we have the EHR where we have the one column which say the gender, and in the gender columns we have M, F, male, female. In one hospital, in another hospital we use male, female, and another hospital we use men, women. Then if we would like to combine that automatically, like with the help of tool, you see that because this data is a different, it has a different representation. You know that, I know that, what is the meaning of that, but it not necessarily your computer algorithms will automatically understand and can combine those columns for you. So that's what the standardization is very, very important. Now, core competencies of biomedical informatics. As a biomedical informatician, what are the core competencies, or what should be the core competencies of biomedical healthcare informaticians? So as a biomedical healthcare informatician, it should have some knowledge to acquire the data, summarize and explain the history, values of discipline, relationship. So the how the data should be gathered, or certain type of data, like the data gathering from a vaccine data is a difference from the getting a water samples data for the treatment. So the how to get the data through the and different way, like you want to get record interviews, or you want to get a survey, or you want to get the data like the other way, or you want to use the online tool, or you want to use the papers. So these are all come in the data acquiring. Then it comes to the analyzing data, also analyzing the problems, like what is the issue, what's going on. So a biomedical informatician would look the things in a different way than a common man look. A bioinformaticians people look the way as a look at the numbers, and you see that what tools and technology could help to solve this issue. Then produce some solution with some rationale about that, like how what could be the possible solution, and why this could be a possible solution, and what are the issues if we can use with an other kind of the solution with that, what is and why this is an optimal solution. So this is not a common person domain. This is only the people with have a sufficient biomedical healthcare informatics background, they can do that. And once you have acquired the data or the information, analyze that, produce some solution. Now it's come time to implement that. Now the implementing a strategy, implementing a technique, implementing a rule, implementing a regulation, who should get the oxygen when all the patients are dying with COVID. So you see, this is very ethical question at the same times, but you cannot deal with this question with emotion. You have to look with the society, that how you can you have to come up with some protocol, come up with some strategy. So this is kind of the implementation stage. So, and implementation stage is depend on with a case by case. And based on that, like if you have learned from this experience, what is the new innovation come? What is the new theories, topologies, framework evolved out of your learning? And then how this lesson learned you can disseminate, or you can work collaboratively with others to show the demonstration of your innovation, and also to disseminate this knowledge to the others people to use. So these core competencies should be on your fingertips: acquire, analyze, produce, implement, innovate, work, and disseminate. It's up to you, whatever way you can. People sometimes use a PIWD, some make some abbreviations to remember. So it's up to you, whatever the way you write. But uh, this should be on your fingertips: acquiring, analyzing, producing, implementing, innovating, working, dissemination. Okay. Now, with that, we see this. There are some core competencies. There are some the need of driving force. We are pretty much convinced that the healthcare informatics is very, very important, and and we see a lot of benefits. But is there any issues with healthcare informatics? Is everything is fine? Everyone is implementing? No, there are a lot of barriers. And what types of barrier in healthcare IT or health IT? This is another concept: HIT, health IT. Health IT defines overall. Biomedical health, we call it health IT. Biomedical informatics, healthcare informatics. One first barrier is not enough time. As new tools and technologies are evolving, implementing training staff. You see the doctors, what you can expect from a cardiologist over the age of 60. I mean, you want him to learn some new basic Excel and techniques in the health. I mean, people are very reluctant. They don't have enough time. They have their own experience, and they want to go with their own experience. They say they feel that like it's kind of totally the consuming their time for nothing. So not enough expertise and few more formal training is in informatics. So the doctors, they have to get training. We have to train our all staff. It comes with a different disciplines, age, gender, and the people. So it's not that easy that we can totally replace it with a digital, with a healthcare informatics, applying all sophisticated tools. And even if we try to do that, we don't have enough money. Not every hospital they would like to spend, or the healthcare setup would like to spend on this. And the thing is, lack of interoperability and between technology. This we will learn in detail what is interoperability is. But at this time for you is that every hospital is using different tools, techniques, sets, or softwares. So if to get a kind of the concise, like integrated knowledge, we would like to combine. We want to combine several practices. We like to combine the patient data. That's at this time currently is not going the way the health information would like to. We manually have to do this thing. Some tools sometimes work, sometimes does not work. And now there is no clear ROI, return on investment, on that. People, those hospitals, those who have spent millions of dollars implementing this technology, hiring new people, they don't see much value about that. Why they don't see that? Because this is too soon. It takes years and years to get some value out of that. Then people have the privacy concerns. People, they don't like to share their data online. The people are very reluctant to go online and share and fill the form over there. They say like this they are kind of a breach to their personal or the privacy. Also, new legal concern. If what happens if some person's data will leak every second day? We will see that there is kind of the cybersecurity threats and attacks. Who will be responsible? Hospitals? people, no one would like to take blame on that. Need for behavioral changes, about 50% of the staff will be slow to adopt new changes. So these changes that we have, and many more, these are some top kind of the barriers. And if we can fix this thing, maybe the healthcare, we see more and more healthcare applications. Now, who does biomedical healthcare informatics? Or in other words, like what are the jobs, perspective of healthcare informatics career paths? So usually, at this time, as we have the discipline BS Healthcare Informatics. We are going to start mastering healthcare informatics online soon next year. And more universities and disciplines are, even the hospitals are now making their agreements with universities to start new programs. So the healthcare professionals, natural life sciences people, computer scientists, health information management people, library people, they are now realize that their next step should be to learn biomedical healthcare informatics. Why? They see that it's the jobs markets are there as a healthcare system, clinical leadership in IT, in academia, in industry. So with that, healthcare at this time, healthcare informatics is one of the popular disciplines which the peoples they are trying to learn. And if we look at the jobs market, so these are some key roles in the industry. We see the people with the role of healthcare informaticians, consultant, clinical system analyst, director's position, chief medical officers, healthcare project manager. So you see these jobs were not existed even 10 years before. So at this time, you see more and more. This list will be double or triple every year. You see more and more people now with a blockchain, with kind of new computing technologies, with the quantum mechanics, with artificial intelligence. More and more people and more jobs is being generated. It's like becoming a next $1 trillion industry. So that's another motivation why you should and everyone should learn healthcare informatics. Those who are interested in informatics and computer science. I have added some key links here. Please go over to these links. These are very, very important. For example, you should know that what is 2016 interdisciplinary standard, what is the EMEA, what is the meaningful use mean, what is the high-tech word mean. So these are the things. These are key concept. At least you should know what is a high-tech act, what is the meaningful use. So please go over to these. So these are your homework to do that, and also to go over to these slides which we have discussed. Listen again and again, and also must read the book. Complete your chapter 1 and create your own notes. Right. So with the more fields. So here, at least you should go at least visit what is EMEA. Is American Health Informatics Management, EMEA, HL7, AHRQ. So you should know at least to go to their website to see what they are doing that. Okay. So with that, I will see for you to do that. I will share, as a course project. First, you go to the chapter 1 and read to the book. Also go to the slides. Second, you should post on Piazza go to the Piazza and find your partners to create your group. This is your job. I want in a lecture 3rd, all the group members and with their names. I want to create a group and also review class project and material. When you will go to your canvas, you will see one folder. Go down you will see class project and with material. I will share more information about that. I will probably create a video that how you should go over to read material and how you can read this material to find your research topic and to find your team. So that's all for today. I will see you in the next class. Thank you so much.